Good evening, everyone. As it's the first meeting of the year prior to selection of our chair, I'm going to get us started. And as I call the meeting to order here at 4:02 p.m., I'll start us in a good way, acknowledging the land that we are gathered on today, which is the Treaty 20 territory and Williams Treaty territory of the Mississauga. And through winter, I think about, and there's lots of snow out there. Good thing we're meeting virtually today. Through winter, I think I think a lot about the land and the land having time to rest. Certainly, I've learned through conversations with Anishinaabe Huron territory about Mother Nature and her need to rest through the winter. But I also think about the special animals that we see through the winter. And one that came up this week because my dad sent a video of this to me. The Anishinaabeg word for the animal is mawinans, and it's I'm going to just show you a short video here on my phone. Oh, see if it's kind of blurry. I think I have to take off my background, but you can see this beautiful eastern screech owl that my dad had sent me a video of, and I think about these animals that bear through the winter, stay around Canada and in our backyards and spend some time through the cold. So acknowledging Mawinans, the screech owl that made its presence at my parents' place this week. So with that, our agenda today has been circulated. Before we go through that, I'm simply going to start with item number 2, which is elections. And the first item is election of the chair. So you'll see in the package the proposal for Ron Black as chair of Lakeland's Public Health for the upcoming 2026 year. We'll get to the other items, including vice chair and committees shortly. But for this first item, I will seek a mover and a seconder for the recommendation for Deputy Mayor Black as chair. So moved by Councillor Ryall, seconded by Dr. Makija. All in favor? And that is carried. So with that, I'll turn it over to you.
Thanks, Dr. Piggott. Appreciate the support and confidence in having me back as chair for the next year. I think there's a lot of great work's been done, and a lot of work to be done as well. And I think continuity, again, given the bit of a shorter year for the municipal members, given the election in October. I do appreciate the support and confidence moving forward. So I will move to item 3, which is declaration of pecuniary interest. Are there any declarations of pecuniary interest? I can't see everybody on the screen. How do we get?
Oh, maybe if
I can fix it.
If you're not spotlighted.
Oh, that's a little better. Okay. Seeing none, we will move. We're going to adjust the agenda to accommodate some members who need to depart. So we're going to move up our in-camera session today. So with your permission, we'll defer item 4 till after our in-camera session, and we'll come back and open so we don't rush through it. So I'll ask for the amendment next that we move the in-camera portion of the agenda into item 4. Motion for that. Councillor Richardson and Councillor Ryall. All those in favor? Thank you.
I'll need to stop the live stream.
Yeah, so we're going to stop the live stream and we're going to move to the in-camera agenda. So do we do the motion in open to move in?
Oh, we didn't do that.
Yeah.
Go ahead and just do.
Okay. Yeah, so I need a motion to move into in camera at 4:06 p.m. And we have Mr. Maloney and Dr. Makija. All those in favor? Thank you. And we will move into in camera at 4:07 p.m. All right. In accordance with, I'm not going to read them all out, but in accordance with the Municipal Act.
One part.
right, so we'll move to adjourn the in-camera session. So I get a motion to adjourn the in-camera session at 4:59. Gordon Clark, seconded by Councillor Royale. All those in favor? Thank you. That's carried. All right, so we'll move back to our regular agenda, and we're going to move to item recognition, item 4, which was moved. And we've done the adoption of the agenda with the changes, right? Yeah. Okay, so we're going to move to item 4, which is recognition of departing board members. So I think you're all aware that Mr. Johnson Paul indicated his intent to conclude his provincial appointment with the Board of Health at the end of his term last month. In addition, we were advised by the ministry earlier this month that Mr. Marshall's term was not renewed. We've reached out to both members to thank them again for their time and dedication to the board, and I've offered an opportunity to participate in exit interviews and share their feedback and insights with a number of options of how to do that. I'd like to briefly extend my personal thanks to both members for their service. I will begin by offering a few remarks regarding Mr. Johnson and then turn it over to Councillor Royale, who will share some comments regarding Mr. Marshall, having served with him on the Legacy Board. Paul was appointed in April of 2023 for an initial one-year term, which was later extended by the ministry through the end of 2025. Coming from the city of Peterborough, he came to the role with an extensive background in information technology, along with a strong commitment to volunteering and community service, evidenced by his longstanding involvement with the local Salvation Army. During his tenure, Paul made many thoughtful contributions to board discussions, served as a member of the Indigenous Health Advisory Circle, and demonstrated a strong commitment to public service. So we are very grateful for his
it might be half an hour yet.
Service to Lakeland's public health. Councillor Rao, I'll pass it to you to have a few words with respect to Mr. Marshall.
Well, first of all, thank you very much for the opportunity to recognize David Marshall and the remarkable contributions that he made to the Legacy HKPR District Health Unit and the merged Lakeland Public Health Unit as well. David joined the HKPR Board of Health in May of 2021 and immediately became engaged and a committed member. He was really involved with what we were doing. And in 2022, October, he stepped into the role of interim board chair. And in 2023, he was actually elected the chair, a role that he carried out with tremendous experience or expertise and professionalism. And beyond his responsibility as board chair, Dave was also co-chair of the Joint Merger Steering Committee, and his leadership, stability, and thoughtful approach were invaluable as we navigated the complexities of the merger process, especially when it came to asking the tough questions and performing in-depth due diligence, because that was one of Dave's real strengths. His leadership, stability, and thought, we deeply appreciated the time, energy, and dedication he brought to both the day-to-day operations of the board and the strategic work guiding our future. David was constantly demonstrating a strong understanding of the governance, oversight, and fiduciary responsibilities that were required of him. He acted with integrity, with good faith, and always in the best interest of the organization. His work ethic ensured that the public health continued to operate efficiently, responsibly, and in the best interest of the public itself. David also shared valuable expertise in human resources and business management. That knowledge significantly supported our ability to meet the good governance and management practices required in the Ontario Public Health Standards. His insight strengthened our processes and our commitment to the accountability, and transparent governance. David, it has been a real pleasure and honor to work with you on the Board of Health, both of the legacy and in the new one. Your wise counseling experience and dedication has made a lasting impact on us. And thank you for all of the contributions, and the best to you in where you go in the future.
Thank you, Councillor Royale. Again, thanks to both members who have made a significant commitment to the board, and especially through the merger process in the past year. So thank them again from myself and the board. We'll move to item 6, adoption of the regular minutes. Minutes from the previous meeting were circulated prior. It's approval of the minutes of December 17th, 2025. A motion to receive, Mayor Logel and Dr. Stelzer. All those in favor? That's carried. Thank you. Is there any business arising from the minutes that anybody wishes to discuss? Seeing none, we'll move to item 8, medical officer's update. Dr. Piggott is going to take that one.
Thank you, Chair. So good evening, everyone, and happy January. Today our board meeting happens to be falling, as you probably know, on Bell Let's Talk Day. And so first thing I want to do and say is acknowledge mental health at this time of year. The day's picked because the weather is usually and seasonally today not great. The days are short, and it can be a really trying time for people, for families, several weeks after Christmas holidays, December, the end of the year, sometimes a period of significant financial pressure, and certainly for many people, a period of great stress. So acknowledging that day today, and certainly thinking of people who are struggling, and hoping that they will reach out. Our website has information and materials, and lots of, throughout the region, good supports available for people from a mental health standpoint. Really important. I also want to acknowledge all the hard work our teams are doing, and our partners that we work with in healthcare, primary care, the hospitals, at this really busy peak time of year. Respiratory viruses such as influenza, COVID, and RSV are really challenging through the winter months. We have, I'll speak briefly, and certainly Dr. Bocking happy to elaborate or answer questions, but we have just recently passed the peak of influenza. We're seeing rates decrease, but this has been an extraordinarily difficult influenza year. We've seen more deaths and hospitalizations than we have in recent years. And in part, that is because of low immunization rates, unfortunately. Very low immunization rates, and certainly encourage people to think about immunization. We're starting to get later in the season, but there's still utility. The other components from an influenza standpoint are, you would have heard about H3N2 subclade K, the strain circulating that seems to evade the vaccine protection a bit more. The vaccine still providing important protection, as Dr. Bocking presented in the fall, and our teams have been encouraging and getting the word out, but the protection has been less than in some years. So influenza has been hard. Certainly COVID rates have continued and increased in the last number of weeks. RSV rates are increasing, but it's important to note RSV really is a good news story. We're seeing rates, especially of severe disease like hospitalization, far lower than in recent years, and that's thanks to the vaccination. Vaccines available for infants, the injection for infants, as well as for older adults. Now anyone 65 years and older eligible, 75 years and older eligible. That is a tremendous program that is certainly saving lives and helping to declog hospitals and our healthcare institutions. Finally, the last thing I wanted to acknowledge and to say, and this is a tie-in to some of the challenge that I'll talk about that our staff have experienced, and some of the work that we have, really important work we have to do around our team and our culture. But it's just an acknowledgement of how hard last year was, and how hard the start of this year is. I don't know if anyone else saw this, but I saw a bit of a joke thing on the internet around the first 7 days of 2026, and somebody saying geez, I appreciate the free trial offer of 2026, but I'd like my money back. We in our community live in the broader global context, and I think it's important to say things are not normal. Things are not okay. The broader geopolitical context of our country and the world is challenged. This has impacts on people's health and mental health. This also will have direct impacts on the work that we do. Historically, in this country, we relied heavily on information coming from south of the border, evidence from institutions that we can no longer trust in the same way. The certainty and quality of that information is a challenge. And beyond that, we will have to figure out as a country what we will do to ensure we step in and step forward and provide evidence and information where there are new gaps, given the context of everything that we're facing and everything that's going on. So with that, just to finish and to say, I'm thinking about community members at this time of year, and given the current context of the world and stress of it all, I'm thinking about our teams that are doing tremendous work to protect the public health of residents of our region day in, day out, and through a really challenging merger period. The last thing I'll leave you with is something that one of our staff shared with me, which was learning for me, but the Chinese zodiac calendar, I think, is really symbolically interesting as you transition from 2025 to 2026. 2025 was the year of the snake, and certainly with it for us, for the merger, posed significant challenges, but the snake, in shedding its skin, turned the page to the year of the horse. And, symbolically galloping forward and onwards, I think, is what we as Lakeland's Public Health and in our community need to do. But I'll say and finish with this, which is, I think it is far more important as we have the year of the horse and we're galloping forward, that we in public health, we trot together, we slow it down, and we come together, whether it be within our teams, with our partners in a community, with the community at large. Better to slow down and to trot together than to gallop alone. Thanks.
Great. Thanks, Dr. Piggott. Any questions for the doctor? I see Councillor Real. Go ahead. Yeah.
I just have one question, Dr. Piggott. And we're all aware of what's going south of the border. My question is related to the availability of vaccines. Do many of our vaccines come from the United States? If so, are they subject to tariffs or restrictions that make it difficult for us to get enough for our people?
Yeah, I'm not sure, Dr. Bocking, if you want to add anything, but most of the vaccine procurement is not done by us, it's done by the province. We haven't been notified of immediate changes or concerns, but certainly at a high level, yes, we will procure a lot, both medicines and vaccines from the States. So this is on my mind, and I'm sure on the province's mind as they're doing planning.
Thank you. Any other questions? Warden Clark.
Yes, thank you. And to that point, and I can't remember, I was in a meeting where that question was answered around tariffs, and I was told they were not. Can we clarify that? I'd like to know the correct.
We'll get back to you on that. My comment was that we haven't been informed of challenges with procurement. I'm not sure if prices have changed in any way. But we can get back to you, Warden Clark.
Thank you.
Quickly on that.
With the province.
Maybe just let us all.
You heard it in the right.
Maybe just an email to everyone, just so we're aware. Thank you.
Yeah, thank you. Any other questions? I have one quick one for Dr. Bocking. I know, Dr. Bocking, in the past you said it's been difficult to really track influenza vaccination rates because it's kind of done in a lot of different ways. Have you got any sense of the delta year over year, last year versus this year, of what that really looks like right now?
Yes, through you, Mr. Chair, in response to your question. So I don't have data specific to Lakeland's public health region, but I understand provincially we did see increased uptake of influenza vaccine this year compared to last year. It is still less than what we would typically see prior to the COVID pandemic, but I think we're all a bit encouraged that perhaps some of the promotional efforts this fall and understanding that it was a pretty severe flu season has led to increased uptake.
Thank you. Yeah, flu season started earlier, and I think maybe that encouraged more people to get vaccinated. Thank you for that. All right, any other questions for either Dr. Bocking or Dr. Piggott? Seeing none, can I get a motion to receive Dr. Piggott's update? Excuse me, update for information. Dr. Makicha and Councilor Real. All those in favor? That's carried. Thank you. All right, so we're moving now to item 9 on reports. And Dr. Piggott is going to speak to our strategic plan progress and workplace culture update. And I believe Jen Harrington is now in. I see her just joining. There's Jen. Thanks, Jen. Thanks for joining. So Dr. Piggott's going to start with the pres, and Jen's going to be here to help answer any questions moving forward.
That's great. Thank you through you, Chair. Welcome, Jen. And you will all know Jen from the retreat and support that we've had from the Rising Collective through the journey we're on. We had an update last in the early fall at the retreat around progress. A reminder overall, if you go on to the next slide, please, Michelle. The journey that we're on from a strategic planning standpoint, which is both important for a newly merged health unit, but also a legislated requirement for us to produce a strategic plan, is a fairly long one. We're trying to do it thoughtfully, slowly, and make sure in the process we have deliberative conversations internally with our teams, with community members and with community partners so that we really listen, learn, and figure out the direction and priorities headed forward. The update today is as we come to the conclusion of the phase 1 engagement that a Rising Collective supported us on, the end of some of our internal engagement work and culture planning. I'll come back to later in the presentation some of phase 2, which will be the external community engagement and definitely roles for the Board of Health to support in that. And finally, bringing it all together, highlighting the priorities and finalizing the strategic plan will be in phase 3, which we anticipate will be later this year. As we've set the goal of having a strategic plan later this year or very early next year to help to guide us in the post-merger funding period. A reminder, merger funding continues until March 31st, 2027. On to the next slide, please, Michelle. So as part of the phase 1 and talking to teams and understanding where people are at and our existing culture and the culture we aspire to, Rising Collective supported a number of conversations with our teams. The goals were to use multiple ways of engaging staff to better understand perspectives around proposed culture, values, and to start to help us with forming the culture that we want to create. On to the next slide, you can see some of the numbers that just are indicative of how great the participation was with staff. We had almost everybody participate in either an in-person or virtual session. We had managers involved in sessions, senior team members were interviewed, and this all was collated really marvelously by Jen and team to help us to understand some themes of priorities as we set the culture going forward. So the outputs that we're going to talk about here today are some of the findings of that engagement and some of then the work that we're going to do towards the culture we want to create. On this slide, with regards to findings, thank you, Michelle. I think overall, and the bottom line message that Rising shared with us, they joined us at our all staff day in November to share these results with our staff directly and to validate them. They listened, we had an exercise for feedback, and we've had ongoing presentations and discussions through Rising. The bottom line was that we have staff that genuinely care and are committed to Lakeland's public health, our work and our mission. And this was consistent across all different staffing groups, professions, and geographic locations. At a strength level, staff shared real commitment to our work, to collaborating in their teams, gratitude for supportive management, and really remarkable adaptability and resiliency through the merger, which has been hard. It has been hard, and they shared some pretty real challenges, a sense of an erosion of trust in this journey that we've been on. Concern that senior leadership team has not been functioning cohesively. Concern about management capacity and the burden on managers and making sure they have the resources needed to effectively support their teams. A need for clearer communication, a need for clarifying roles and scope and authority responsibilities, a desire for more authentic engagement and follow through, and challenges around just the volume of change that's happening in this merger, and change management fatigue, and some of the timelines that have been pretty fast as we are trying to work through the province's funding and pressures that we have to move the merger forward. The engagement around values demonstrated a strong alignment with existing legacy organizational values, which were not all that different from one another, and the surfacing of some new ones. Ultimately, a desire to see a unified culture that builds on our strengths and really helps us to move forward together, empowering our great staff and the great work that we do for our communities. On to the next slide there, Michelle. Ultimately, we've articulated a workplace culture we want to create. So it's written here, but creating a Lakeland's public health that's trusted, community-centered, with a team that has the conditions to be valued, supported, engaged, physically and psychologically safe, and ultimately empowered to do their best work in the service of the diverse communities we serve. The values that surfaced, the 5 values that surfaced, that will continue to define and refine through the subsequent phases of planning are advocacy, collaboration, excellence, integrity, and respect. And the surfacing of health equity, not as a value, but rather as a lens and a key core mandate that intersects with all the work that we do in public health. On to the next slide, Michelle. The plan we're working through as a senior team and engaging with managers and staff around actions that will be taken to work towards the culture that we want to create. They'll be grouped into review around leadership, around structure, around accountability to set the tone and structure needed for our whole team. Connections and collaborations so that we can build one unified culture, and support through the conditions so staff can grow personally and professionally to ultimately have healthy and thriving staff. The last piece I want to finish on here is in regards to the next stage. And Jen's certainly here to listen to the board's questions, perspectives. Feel free to add to Jen, but we're really excited to be embarking on external engagement. The Rising Collective has a lot of experience engaging communities, including our communities that we serve here. And they're going to be using these external engagements as an opportunity really to highlight about the change and make sure people understand what Lakeland's public health does and the changes that have been happening. Gather insights around our vision and our mission, and really uncover priorities for us to inform the strategic plan. They'll be helping with focus groups, interviews, public communications and survey, and town halls. Finally, on to the next slide. This will be carrying out through March to June, and some questions we wanted input from the board on. Maybe I can turn it over to you, Jen, if you don't mind, just to lead us through the end here around the questions you wanted to hear from the board on.
Yeah, absolutely. Thank you, Thomas, and thank you for providing that great overview. You each are here because you represent municipalities, different constituents, etc. So would love your input on how we can best engage communities across the 4 counties. How do we engage community partners? Who are they, and the broader public? We have started to develop a list of folks, especially community organizations that we want to engage with as part of this process. But certainly interested in your input as well. And ideally, we want to really understand how we can elevate discussions. So we're focusing the discussions on long-term health of communities and not, on like immediate political kind of in the weeds discussions, which some of them might get to. So Thomas and I chatting before, we're like brainstorming how we can ask you for support and what that looks like in different ways. So certainly attending hall sessions and encouraging folks to attend. Speaking with your constituents, speaking with partner organizations, and really just being ambassadors of this work moving forward. Gathering your input, asking questions, making sure people understand who LPH is, what LPH does in community, et cetera. Thomas, I'm not sure if I covered everything there, but yeah, certainly open to input if folks have thoughts or questions. Bonnie?
Thank you. That was very fast, Janet. A couple of things. Have you reached out to all the partners? Because we do have certainly web pages and can put information out that way to promote and clarify. So I would say, I'm speaking on for the county, so we do have a communication team that we can help. Then when I turn over my lower tier, OSM, of course, we can put those out on we have 3 signs, digital signs, that when you're having events, that would be one way we could help promote. And I think all the partners around the table here likely have communication tools that would be very, I think would serve us well.
Great, thank you for that. And we're working closely with the comms team at LPH to coordinate that. So yeah, we'll make sure that is shared. Tracy, I think you had your hand up next.
Okay, Tracy, yeah, go ahead.
Yeah, I know it's hard to see who's doing what right now. Thank you. And through you, Chair. Is there any concerns regarding timelines just because of, the capacity, the ongoing merger work and the operational demands right now on staff, or?
Thank you, through you, Chair. I think Councillor Richardson, we're intentionally taking it slow. The engagement through the fall was a lot slower and more detailed than sometimes might be done for strategic plan, but I think it also was really important for our staff, even therapeutic. I think as we turn to the phase 2 and external engagement, that's equally as important for our communities. I think we're okay on the timelines. We intentionally wanted to not rush to having the priorities that would guide us forward because our teams are still coming together and understanding how work was done and future priorities. So I think as we get towards the end of the year, we will have better clarity on that and be positioned in a good way to have priorities to help to guide the work going forward. But we're continuing to evaluate this project as well as all of the work that we're doing from a feasibility and capacity standpoint to make sure that we're doing it well and that we're not burning out staff.
Yeah, thanks for that, Dr. Piggott. I think it's Councillor Royale, then Councillor Joyce, and then Councillor Rial.
Yeah, first off, that's excellent presentation, Dr. Piggott. I really am really great with that. And Cindy, that was awesome too. My question is always related to the same thing. We're moving now from the overall planning stages where we're laying out what we're going to do to the overall action parts where we're now going to start performing things and making stuff happen. So my question is related to measurement of that and knowing, are we there yet? Because when my daughter was little, that was the question happened. Are we there yet? Where are we? What are we doing? And in light of where we are with the province, which obviously we're looking for more funding from them, and we want to let them know that at the end of the day, what we have done with what they've given us so far, whether it's been in kind or whether it's been money, has produced excellent results. And when we were talking to Dr. Moore, he indicated that there were matrices that were related to measurement that the province uses in some cases. Are we at a point yet when we can start looking at that kind of stuff? And if not, is it something that we should be building into the plan before we actually start? Because I think it'd be extremely important that not only could we show our results in terms of verbiage, but we can also show it in terms of tangible measurables. And I think that's going to be a big thing going forward, especially in the third year of what we're doing.
Yeah,
thanks through you, Chair, and thanks for the question, Councillor Rao. an important one. I think measurement and understanding where we're at, how we can improve, constantly part of the culture we're looking to create here. In regards to the presentation of this evening and the culture plan and work, I know Jen and team have been helping us to make sure that our actions are very specific and measurable. We also have other tools that we've been utilizing, including an engagement survey that we did later in the fall that we'll be able to repeat over time, and it will help to show quantitatively how engagement is across all staff teams, and how that changes over time with some of the work that we do to improve our team function. And then as it relates to the broader question of performance measurement for the work that we do for our community, that's part of the review that teams are doing, is understanding what the key indicators are. The province has their own set of indicators, making sure we comply and we're doing well in those, so that we're seen favorably when it comes to our reputation and their funding and the work we're mandated to do, but also at a team level. What are the indicators we're tracking to know that we're doing the best that we can in the service of our communities? That's part of the work that teams are doing, as they're assessing how work was done. Both organizations used measurement and assess performance in different ways, and we're looking to understand that, but also then do that better over this year or so.
Thanks, Dr. Piggott.
Thank you.
All right, we'll move to Councillor Joyce.
Thank you, Chair, and through you, I think the forward slides there look good in terms of where we're going. My question is just actually going back to phase one under the challenges budget there, that we've identified challenges: erosion of trust, greater capacity for effectively supporting teams, need for clearer communications, et cetera, et cetera. These were all items identified in advance in the change management process. The whole change management, we were supposed to smooth this stuff over, and yet they still rose to the top. I don't understand why. I mean,
yeah, thanks for the comment. I think in any merger of this type, change management is always the biggest issue for the first little while, and there was unfortunately going into it, there was a lot of trepidations because it was delayed, and we, as Dr. Piggott said earlier, rushing into trying to get stuff out the door. I don't think it was unexpected that there still would be a certain amount of challenges in unifying the culture and that sort of thing, because it was things to do. And I think overall, as the board chair, I think communication was done very well. But change is hard for a lot of people, and so it's not a surprise to me that 6 months into technically the merger process, when most of this interviewing was done, that there were still people that felt challenged in a lot of different areas. A lot of work to be done. I'm not saying there isn't, and I know Dr. Piggott, myself, had many conversations so far on moving that forward. So I'll pass it over to Dr. Piggott as well.
Yeah, no, thank you, and thanks for the comment, Councillor Joyce. I think I'm very forward-looking to how we can continue to do things better into the future. I think there's loads we can learn about what we've been through as we get there. I think this is a full senior team activity and effort, and something that we care. I know our whole team cares deeply about. I think certainly some of the challenge was hard to hear for us. I'll be honest. I want to acknowledge and say it's been a hard year. 2025 was a hard year. That change and the change we've been through was hard, but I think we're forward looking. What do we do now going forward? How do we make it better? And the fact that, to me, staff are willing to share, and they haven't moved with their feet. We haven't seen turnover and loss of staff. They want to be here and they want to be part of making it better into the future. And I think that, to me, is encouraging. I don't know, Jen, if you want to add anything to the context of some of those comments. We just to assure the board, had a number of immediate actions we had in response to the engagement that we did in the fall. So we've implemented that, and we've been working more thoughtfully in a full action plan that we'll be carrying out in the next number of months. But culture and this work is ongoing. It's long term. Mergers are hard, and to the comments earlier, we're in a tough geopolitical context and environment too. Leading and our work, especially people who are in client-facing work, they see folks and families that are struggling and are suffering. And so I think it's hard, but what I think to me is really important is that we come closer together as a team and we move ourselves forward in a good way.
Thank you.
Jen,
Thank you. Jen, anything you want to add to
Just that this was like a kind of a pulse check on where staff were at, and it seemed like they really appreciated the opportunity to share their thoughts, to share what's working, what's not with us as part of strategic planning, but also just like there's an overwhelm, right? Like change is hard, as Thomas said, and as you said, Ron, it's hard. So the check-in, I think, was a really important process, and we've gone back to them with the results and with validation. So I think that on its own has just been really, really useful, just in terms of staff development, trust building, etc.
Okay, well, thank you for that. And I missed the employee day because it was scheduled on. I had a conflict and I couldn't attend, so
Yeah.
there's that too. I was not there, so
yeah, it was a very uplifting day.
okay, thank you.
Yeah. Councillor Rial, then Mayor Logel and Warden Clark.
Through the chair to Jen, building off of Warden Clark, I think I don't know, maybe you have reached out to the city, but we have a communication department, but also we have moving media in all our public buildings and out on the city itself that you could probably avail yourself to, and certainly get in touch with Director Brendan Wedley. I don't know, maybe you've already done that, but I mean, certainly it's a cost-effective way to get your messaging out, and certainly they're in all our public buildings, the moving media. So really in an expensive way, or probably no expense whatsoever to get your message out.
Perfect. Thanks for that offer, Councillor Rial and Mayor Logel.
Thank you, Chair. At the bottom of the final sheet, there needs support from the Board of Health. I just want to tell you that in Northumberland County, there were a lot of people, and I'm talking about the regular souls that walk up and down the streets and chit chat and everything else. They were very interested in the amalgamation of the two boards. And I think it's so important that we keep going and providing information and letting them know what's going on, because they are very interested, and it's a big change. And I promote and I would encourage that we do host those township sessions, or town hall sessions, I should say. And I would like to participate in some of those, but I'm just not familiar enough of when they're happening and when how I can be there. So if there's any information on those, I'd certainly be appreciating it.
Great. Thanks, Mayor. Jen, any idea when you think you would have somewhat of a time frame, agenda, meeting, where, locations, that sort of thing?
So still at early planning stages, we're trying to get input just to make sure that we do it right the first time around. Likely March through to June is when public engagement will begin. So there's lots of time to plan properly and set everything up. So
Okay.
we'll pass on that info when we have it.
Yeah, we'll make sure through you, Chair, that all the board is aware of all the sessions, but also especially for people who are tied to geographies, they're included for those, because I think the participation is critical, and that's
Absolutely.
But I think it's a great and exciting opportunity. I mean, there may be some tricky conversations to stick handle around, and I think that's okay. We're better to have honest conversations with the community about our work, help people understand what public health does, and hear their perspectives so we can carry that forward into our strat plan and priorities.
Perfect. Thank you. Warden Clark.
Yes, just a last couple of comments. Jen, if possible, when we are having a board meeting in that area, it would be nice to have a town hall session we could attend to, we're already there, the people that are traveling, and that may be an opportunity for more board to attend. The other thing, I certainly was there, as Dr. Stelzer, Hans was, when the two hospitals come together. Those comments are not surprising at all. I think the cohesiveness of the leadership team, Thomas and Natalie, are pertinent. And I think basically what I'm saying is this starts at the top and through that leadership, and we have to show that. So thank you.
Yeah, thank you, Warden Clark. Dr. Stelzer?
Thank you, Mr. Chair. I'm just wondering, when we're looking for external input, and I realize that public input is forthcoming, but given that, you know, in our community and communities at large, we have huge problems with homelessness, addiction, misinformation or vaccination, for instance, mental health, especially in seniors now. Are we going I mean, these groups are not likely to show up at any, you know, public meetings. Are we making a special effort to target these groups and get their input? And are we going to make special accommodations for them in our strategic plan?
Jen, did you want to talk to, you know, I think the external piece is going to include key stakeholders that have more of a primary responsibility for those than public health. We integrate with them and we work with them. We provide resources, we provide service, but for the most part, that is done by external stakeholders. So I think that's the most important piece, is making sure we hear from those stakeholders, and we have a large geography. So we need to feed Jen who those stakeholders are in Haliburton, in Coboconk, in Fenelon Falls, you know, wherever. Are there groups that we need to make sure we're engaging, who work with those files in their neighborhoods? So Jen, you talk a bit more about how you're going to find those opportunities.
Yeah, thank you. You pretty much answered the question. It is through those who do the work on the ground. We'll be engaging those partner organizations who have that knowledge and that experience and that expertise. But it's a really great question, and maybe there's ways of engaging partner organizations or providing them with material so they can further engage their communities, so we can get that input. So we'll continue to think about that. There is there will be a broad community survey, though we know that not everyone can also fill that out. But we intend to issue that as well. So that will help get some more responses anyway. So we'll consider to think about that. Thank you.
No, it's great, a great point and comment. And we do have an equity lens for engagement that many programs use. So we might be able to leverage some of the work that individual teams and programs and relationships and connections they have directly with clients.
Great. Yeah, I think
Thank you.
Thanks for the great question, Dr. Stelzer. All right. I see no other hands up, so I'm going to ask for a motion to receive the presentation for information today. And I see Warden Clark and Mr. Maloney. All those in favor? And that's carried. Thank you. All right, we'll move to committee appointments. Dr. Piggott's going to speak to that one.
Yeah, so it says in the package, thanks everyone for putting forward their interest for positions. Did we do the vice chair, please?
No, we're going to have to do it because we only did the chair.
Just for the chair, we only did the chair.
Yeah, we only did
Thought
the
it was
chair.
in
Yeah.
one motion.
Yeah.
First, and then we'll do
Sure.
counselor. Well, yeah. Counselor Ryle can have his own special moment then. So I think maybe you could take us
Yeah,
through
I can take that one through that.
and then,
Yeah.
And then we'll do the committee.
Yeah, so I think the report speaks for itself, and Councillor Rial has graciously put his hand up again for another year to work as vice chair, and I know I've greatly appreciated having him as my wingman through the past year. I think it's worked very well, and so can I make the motion? I can make the motion. I'll move that Councillor Rial be appointed the vice chair for 2026. A seconder for that. Okay, Councillor Richardson, any discussion? Anybody else want to be nominated, or is anybody else going to be nominated? No?
Ron?
Councillor Warden Clark, sorry.
Yes, I think both of you, thank you for everything you've done. And I think going into a new year, it keeps us, you have such a large amount of knowledge, certainly that experience going through. I think we need that consistency. So thank you both for keeping your names in the ring. That's all I wanted to say. Thank you.
Thanks for the kind words, Warden. And All right, any other discussion? The motion's on the floor. All those in favor? Thank you. Appreciate that. Welcome back, Vice Chair.
Well, I guess I should say thank you very much. And you know, it's been an absolute unbelievable pleasure working with the staff. And sometimes when you get into an environment like this, especially when you've got a couple or more than a couple of alpha people, it can get pretty complicated. But I think Ron's comments, and I'm going to give him the same back. The whole idea of being able to work with people who are really strongly committed to making things happen. It's just been an unbelievable opportunity. And I thank you very much for trusting in me for another year.
Great. Thanks, Councillor Alice, Vice Chair. So we'll go through the balance of the report on the committee appointments. Dr. Piggott.
So it's as in the report, board members appointed to the Indigenous Health Advisory Circle, community members for recommendation for appointment to IHAC, and board members for recommendation for appointment to stewardship. So,
all right. We get a motion on the floor for the committee appointments as circulated. I have a mover for that. Mayor Logel, seconder. Mr. Maloney, any discussion? Other nominations? Okay, motion's on the floor. All those in favor? I see some hands. Thank you. Appreciate that. Thanks again, folks, for putting your hands up. We'll have another busy year with committee work moving forward. And I appreciate, again, everybody that put their hand up. All right, so move into 9.3, schedule an honorarium. Dr. Piggott's back up again.
Well, do we want to show it on screen or?
Motions?
No, that's fine. So there's
Okay.
two motions.
Two motions.
One is for the schedule of meetings. So the schedule of meetings, we have a consistent time this year. We have meeting locations and thanks, Alita. Alita's just coming up. We have meeting locations, times, and dates for the full year. You can see we're continuing to rotate around the three larger major offices that can accommodate board meeting, and graciously Curve Lake First Nations offered to host us in June. So with thanks to Councillor Knott for that, we'll look forward to that. So that's the first motion.
Okay, so schedules, can I get a motion to confirm the meeting dates as circulated? And I see Warden Clark and Councillor LaChica. All those in favor? See some hands. Thank you. And
can I just jump in with a question?
Yep, sure.
Just with the committees, remind me how it works with scheduling with that. Obviously, we've got these dates currently in front of us as well as we had them last year. What are we doing in terms of dates for the committee work? Do we know those yet, or are we just going to try to set up the first one and they can create their own schedule?
Yeah, so for you, Chair, thanks for the question. They've been penciled in, and if you haven't had them, we'll make sure you get them soon. I think now that we have the appointments to committees, that those invites should be coming maybe tomorrow. Yeah, soon. But they're all sort of timed and aligned to meet based on content needs for both IHAC and stewardship, and then in alignment with when the board meetings will be.
Yeah,
perfect. Thank you.
Thanks, Mr. Maloney.
They'll be coming for the full year soon.
Yeah. All right, any other questions? The motion's on the table. All those in favor? I see some hands, please. Thank you. And the second motion is to confirm the honorarium for Board of Health members at a rate of $100 per meeting. A motion on that?
So moved.
Mayor Logel, seconded by Dr. Makicha. Discussion? Seeing none, motion on the table. All those in favor? I see some hands. Thank you. Thank you for that. Complete. So we're going to move to the consent items on the agenda. Are there any items that anybody would like have pulled? for discussion? I'm not seeing anybody, a chance to look at them. Okay, so just a brief reminder before we move to the consent items that for members that are interested in attending the 2 Alpha events, please send your expressions of interest to Alita. So the two events is the Winter Symposium, which is a virtual event over just the one day. And then there is the AGM in June, which is a 2-day conference.
Yeah, they're usually over 2 to 3 days, but there's like pre-conference sessions,
and
but the
stuff like
meeting
that
is on the Friday.
Yeah. So all the material is there. The meeting is in that meeting is in downtown Toronto. And the pre-budget submission was included there, which it would be interesting for you all to read closely. All right, so if I can get a motion to receive the.
I have a question.
Oh, sorry. Go ahead, Mayor Logo.
Yeah, I was just wondering, there were some of these courses that you can take virtually as well. And if I'm reading it right, there's a $399 charge for every one of them, or if you pay the $399, you can go to all of them. That's my question.
The whole.
Yeah, it's the whole symposium day. Yeah. You're
Per person, virtual.
Yeah, the virtual one. Yeah, it's for everything that's offered that day. You can come in and out as you please to the different events for the day.
Thank you.
Okay. Any other questions? Warden Clark?
That was my question as well, how that related with the virtual. So thank you.
Okay. See any other questions? All right, so motion's already been moved and seconded? No? Okay, we need a mover and a seconder to receive the consent items. Get a mover on that. Dr. Stelzer and Councilor Rial. All those in favor? Thank you. That's carried. All right, so is there any new business that members wish to bring up tonight? No, nothing new. Okay, I don't see any hands. Thank you. We're going to move to the motions from in camera, which was a little confusing earlier for me, but to my normal process. But we'll move to the motions. And Alita, are you going? Oh, they're up there. Thank you. She's so efficient. There are the motions from the in-camera session. Can I have a mover and a seconder? I can't see hands. Dr. Makicha, I see. Who else? Oh, and Councilor LaChica there. Yeah, I see. Okay. Got those. Yeah. All right. All those in favor? I see some hands. Great. Thank you. All right. All right. We're down to the date for the next meeting, which is February 18th, 4 to 6:30 in the Peterborough office. Let's hope we have better weather than today's weather. And I think we did a good job picking January for virtual for sure today. So that was just luck, I think, but I think it was a good thought that we would not travel in January, but February could be just as messy for us. But
Chair Black, I just got some info. They may be closing the 115.
Oh, is that right?
Yeah.
Oh, geez. Well, it was a good call.
Bad.
All right. Can I have a motion to adjourn? Warden Clark, anybody opposed? Nobody's opposed. We are adjourned at 5:54. Thanks, everyone. See you in February. Take care.